for a 3-week-long sort of adventure, maybe just an experiment, seeing if they could do it. For 3 weeks, covering most of this month, the Republican-led state government in the great state of Missouri decided that they would start forcing the last abortion provider in that state, a Planned Parenthood clinic in St. Louis, to subject every woman seeking an abortion at that facility to a mandatory, medically unnecessary internal pelvic examination. We have been covering this story here on the show ever since it first broke. When the last Planned Parenthood clinic in Missouri went to renew their license this year, the state government told them that in order to do so, they would have to start doing this extra pelvic exam, an extra internal vaginal examination, at least 3 days before a woman could actually get her abortion from the same clinic. This is the first time the state had ever asked the clinic to do such a thing to their patients. It was based, they said, on a new interpretation of existing state law. So it wasn't a new legal requirement. There wasn't the legislature passing this and signing it into law. This was just the state health department looking at the existing law and deciding that from here on out, the clinic, you're going to have to start doing these extra ones. In order to keep the clinic open, these doctors at Planned Parenthood in St. Louis, they agreed to it. They felt they had no choice. The state made it a condition of their keeping their license and keeping their doors open. And so for 3 weeks, the doctors at that clinic were forced to give women an internal vaginal probe for no medical reason, as basically the cost of getting an abortion in Missouri. But once the state government in Missouri started forcing them to do that, they could not force the doctors to stay quiet about it at the same time.
We're not satisfied with the fact that we do the pelvic exam when it's medically necessary. They want us to do the pelvic exam 3, 4, 5, 6, 7 days before they even get the procedure. They want us to do pelvic exams on medication abortions. None of that is medically necessary.
The idea that we've been having to put women through something that's totally unnecessary, uncomfortable, inhumane, just because the state has reinterpreted the rules just doesn't seem fair.
We either have to ask patients to subject themselves to a state-sanctioned, essentially sexual assault, or they can't have an abortion here in Missouri.
Since we first started covering this story, it's been interesting to see the outcry over this policy, this anger over what the state was making these doctors do to their patients. Anger, expression of outrage and objection coming from not just the doctors having to perform these procedures, but from the patients themselves, from medical professionals across the country. But then eventually it broke. After 21 days of being forced by the state to subject their patients to what these doctors considered to be a state-sanctioned, state-mandated sexual assault, the physicians at that clinic finally decided, we're not going to do this anymore. They said, we've done this for 3 weeks. We are no longer going to give our patients a medically unnecessary vaginal exam 3 days before their abortion. We are no longer doing this. We had the medical director of the clinic here on the show that night to explain how he and his colleagues came to that decision and what they thought the state might do in response. Well, that was Wednesday of last week. The doctors standing up to the state government saying, we're done. We know you're making our license contingent on this as a clinic and you want to shut us down, but we are not going to make our patients go through this unnecessary, uncomfortable, inhumane thing just because you say so. How will the state respond? Nobody knew. On Friday, something unexpected happened, which is that the state basically said, well, okay then. They basically said, all right. On Friday, the Republican-led state health department in Missouri took back its new rule that all women in Missouri must get a second unnecessary pelvic exam before they're allowed to have an abortion 3 days in advance. They reversed course. They changed their mind. The health director in Missouri is a man named Randall Williams. He himself is a doctor. He is actually an OBGYN. Oh, he is the one who decided that women had to get this second pelvic exam in the first place. On Friday, he talked to reporters about why he changed his mind. He said, quote, in looking at what they're doing and the fact that they think it causes a burden for patients to do the pelvic exam twice, as a clinician who practiced for 30 years, I'm sensitive to that. He is sensitive to that. It took State Health Director Randall Williams more than 3 weeks to develop a sensitivity to that, to doctors practically shouting themselves hoarse about how his new vaginal probe mandate might be hurting their patients. But after 3 weeks of medically unnecessary pelvic exams and lots of publicity about them, Randall Williams in the health department, they did come around. He decided to tap into his 30 years as a trained medical professional and listen to those doctors at the clinic. Planned Parenthood says because of that pelvic exam rule, because it took the state 3 weeks to change their mind about it, more than 100 women were forced through that. More than 100 women forced by the state to have an internal exam they didn't need. More than 100 women have to take off their clothes, let a doctor insert an instrument inside their body because of a policy the state now reversed. They've now taken it back. More than 100 women forced to undergo those vaginal exams because of what the state now admits was kind of an oops moment. We're sensitive to it now. Planned Parenthood is calling for the state health director of Missouri, Randall Williams, to be fired over what happened to those 100+ women on his orders, which he now says was a mistake. But the state says, broadly pictured, it's all over now. If you are a woman trying to get an abortion in Missouri today, you don't need to get a second medically unnecessary pelvic exam anymore before you're allowed to have your abortion. The state says they're cool with just the one now. That said, the state is still trying to end all access to legal abortion in Missouri, and we've got an update on that tonight as well. Stay with us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.